having the privilege to live in different parts of the world opens your eyes beyond watching something on TV, on the news, or reading in a newspaper, that these places have a different way of life, different culture, a different way of seeing the world. And I think it's hugely enriching for people to spend a bit of time living in a different part of the world.
Alrighty, hello everyone and welcome to the Deal Maker Show. So today we're going to be talking with an amazing founder. We're going to be talking about, mental health, about building, scaling, financing, you name it. I think it's a very, important topic that we're going to be covering. It's something that now is top of mind. There's more consciousness around it, and I think that it's going to be really exciting to be able to dig a little bit deeper, into this segment, today. So again, brace yourself for a very inspiring conversation. And without further ado, let's welcome our guest today, Oliver Harrison. Welcome to the show.
Thanks, Alejandro. It's great to be here.
So born and raised in London. So give us a walk through memory lane. How was life growing up for you?
Well, life was great. So yes, born in St Albans in Hertfordshire, just north of London, and lived here until I went off to university. So one of two brothers, mum's family from Poland originally during the war, though she was born in the UK in 1948, and dad's family, London, born and bred. Had a very happy childhood. My parents were not particularly wealthy, but they put all the money they did have into private education for my brother and for me, and really nurtured our interests in the world. My brother is a PhD engineer, and I realized quite early on that I wanted to be a doctor, and ultimately did well at school, ended up at Cambridge University, studied medicine and neuroscience, and there met some fantastic people who really encouraged my interest in the brain and the mind. And then when I went to medical school at UCL, I decided I really wanted to pursue a career in psychiatry and mental health. I graduated in the 90s. And worked in total for about 6 years, training in psychiatry at Imperial College and public health at Johns Hopkins, but also doing some research in how the brain works using some crazy MRI scanners at Queen Square Hospital, looking at human consciousness and how we process visual information in particular. Realized pretty early on that we were never going to win the battle of supply versus demand. Demand for mental health services, this is around 2000, was increasing significantly. And the supply of human mental health professionals was relatively fixed. It takes a lot of time and money to train a mental health professional. So waiting times got longer and longer. And I became very interested in digital tech. This is the time of the first dot-com bubble, to open up access to mental health services. And then around that time, sadly, I lost two friends to suicide who were on waiting lists for NHS treatment for depression. And that really galvanized me to focus my career on this topic of using technology to open up access to mental health services. I decided to join McKinsey, where I could learn how to use data and technology to solve client problems. Spent 5 years in the healthcare practice, working on technology and data projects with clients around the world. And then in 2006, following a McKinsey project, I was approached to join a group, essentially setting up a new healthcare system in the Middle East. Moved the family over to Abu Dhabi and spent 7 years as director of public health. And there we used data to tackle diabetes, heart disease, cancer, road accidents, infectious disease. Lots of runs on the board. We meaningfully improved life expectancy and became partners with World Health Organization, pharmaceutical companies, IBM, Optum, and so on. And with those runs on the board, when I moved back to Europe, I was approached by Telefonica, the big phone company.
Before that, I mean, it's like all over the world. I mean, unbelievable. What do you think? What kind of perspective did it give you to be able to live all over the place?
Well, I think having the privilege to live in different parts of the world opens your eyes beyond watching something on TV, on the news, or reading in a newspaper, that these places have a different way of life, different culture, a different way of seeing the world. And I think it's hugely enriching for people to spend a bit of time living in a different part of the world. I think it adds a lot to your ability to empathize with other cultures around the world.
And I guess really now tapping into the Spanish goodies, into the Spanish, one of the largest corporation there, Telefonica. How did you, basically cross paths with Telefonica, and what happened there?
Yeah, so Telefonica at the time was setting up a new incubator for innovation, and they called it Alpha, and it was deliberately modeled after Google X. So this was to complement their venture capital investments and their Telefonica eMaste, their R&D, which really focused on improving their core services, so mobile phones, internet connectivity, and so on. And this was looking at what was called moonshots. So projects which are really ambitious, and in Telefonica's case, at the intersection of three things: a massive social challenge worldwide that needed to be solved, emerging technology that could help to solve it, and something where Telefonica had a unique advantage because of their data access, understanding of different markets around the world. And the first topic they wanted to look at was health. And with my background and experience, I was approached by a headhunter on their behalf to have a conversation about founding a new company, supported by Telefonica, but ultimately to become independent. And that's now Koa Health.
So then let's talk about basically Koa Health. What is Koa Health for the people that are listening? What could you tell them in terms of business model, and how do you guys make money?
Yeah, so Koa Health is a digital mental health company that's developing breakthrough technology to solve that gap between demand for mental health services and the supply of mental health services worldwide. We do that by looking at three different domains. The first is ways to detect mental health symptoms, both to detect new cases when somebody develops depression or anxiety, or to look at symptoms as they fluctuate over time in what's often quite a chronic condition. And to do that just using the smartphone, not using a new wearable, but just using ubiquitous technology that everyone carries. The second is personalization, so algorithms for getting the right care to the right person at the right time. And then the third is scalable approaches to treatment. And that's both for people with everyday mental health symptoms who are below the threshold for clinical diagnosis and clinical treatment, and then a set of digital technologies for supporting people in clinical treatment for a diagnosed mental disorder. So put all of those together, and this is a technology stack that we sell as a software, but we also bring our own clinicians through partnerships with provider organizations in different countries, and we offer a technology-enabled service. And the benefits are earlier detection, earlier intervention, less suffering, but a lot less cost, better clinical outcomes. And using our therapy, we can keep people well who have got early signs of developing a mental disorder. Where people do have a mental disorder, for 7 conditions, we can treat with better outcomes with significantly less clinician time. So much more scalable, much more affordable.
So how does it feel to be a doctor running a business? What does that look like?
It felt very early on in my career that the only way to be a doctor was not sitting in a clinic writing prescriptions. And in fact, there are some limitations to that model. You can only see a certain number of people in a day. But if you can create a new technology, then that can help tens of thousands, millions of people worldwide. And I became very interested in this idea of being a doctor, but being a technology doctor. So developing technology that could improve health outcomes. I have a huge amount of respect for people that trained in medicine and continue to work in the traditional way. We will always need people who will operate in clinics and work in operating theatres in hospitals and so on. But for me, that wasn't the right path. And I wanted to do something that could help more people, but also combine my interest in technology and in medicine.
So mental health, why is mental health so important today? And why is all of a sudden, attention, around mental health where before it wasn't the attention there?
Yeah, you can maybe make out in the background here this picture of the brain that my wife got me for Christmas a few years ago. I've always been really passionate about the brain and the mind. When I was a kid and thinking about a career in medicine, I was thinking about different parts of the body. The heart, really important, right? But it's basically a muscle that pumps, and it has 4 valves in it and keeps the blood flowing. The lungs are like air sacs that exchange oxygen for carbon dioxide. Your kidneys are like filters, but the brain, wow, okay, this is like 1 kilo of jelly that sits inside your head that is responsible for your imagination, your emotion, your memory, your creativity, everything that we love about people and what makes us really special as a species and as individual citizens. And we are only just beginning to understand how it works. It is the most complicated organism in the universe. Hundreds of billions of cells interacting in chemical, electronic, and in many ways metaphysical ways. And it's just wondrous. I fell in love with it as a kid and stay in love with it as of today. And I think what we've seen, certainly since the pandemic, which focused the minds, but really since the early 2000s, is a very rapid increase in the prevalence of mental disorders, particularly in younger people. And that has really brought it up the priority list in healthcare systems around the world, such that now we really worry about the impact of mental disorders on labour market participation, people being in employment, people avoiding long-term or short-term absence from work, people being productive when they're at their desk. And those data are getting worse. So it's become a really important priority for families, for communities, for countries, and really for the world.
So obviously, as we were talking earlier, Telefonica got involved and you were part of the incubator that they had and all that stuff. How was that spinning out, type of process?
Phenomenally difficult for a range of reasons. I remember Jose Maria, who set up Alpha and is the president and chairman of Telefonica Group, used to describe Telefonica working with small companies as an elephant in bed with a mouse. So the elephant rolls over in the nighttime and squashes the mouse dead. It didn't mean to, it just did because it's such a big company. So we had huge benefits from being part of Telefonica Group, not only financial support, but also the reputation of a major global company that allowed us to work with the best universities and healthcare systems, Oxford, Harvard, MIT, Stanford, University College London, NHS England, etc. But also access to data sets. So anonymous data for 600 million global mobile phone users on the network. So we could use that data to train algorithms and do really special deep science. So when it came time to move on, there was a little bit of pull, as in we wanted to move, but also a little bit of push. So the financial situation at Telefonica was challenging with the impact of the pandemic in 2020. And really, we were pushed out into the world maybe a few months too early, certainly before we'd had a chance to build a commercial team. And there we were. And now as an independent standalone company, venture capital backed, and looking to build our profit and loss statement and start generating revenues. That transition was particularly challenging for Koa because the Telefonica years were really geared around a moonshot and innovation and radical innovation. But sometimes business is about doing the basics really right and doing it with discipline so you don't spend too much money. And really getting out into the market and engaging with people on what they want to buy and how they want to buy it. So it was a big transition.
So talking about the capital raise too, because obviously you guys had Telefonica, obviously that was a component of being able to raise the money. But how was that journey, like raising the money during the Telefonica years and then post-Telefonica years?
Yeah, so the effort really began midway through 2019, and we started putting together pitch materials, thought in detail about the assets we'd built, how we would go to market, how we would monetize them, the TAM, SAM, SOM, all of that sort of thing. And we knew that the first product we could sell was a prevention product that we called at the time Evermind, and it became Koa Foundations. And we started pitching to VCs. And boy, there are a lot of VCs out there. And I think over the next year and a half, we probably spoke to 160, 170 VC funds. And what happened along the way is we had a conversation with a fund, Ancora Finance from London. We met them actually at a mental health conference, and they were fascinated by our IP. So at the time we had about 20 patents. We now have 56. And they were really interested in a company that had the discipline to protect its intellectual property and to have a good patent portfolio. So that's how that conversation started. And then Ancora Finance decided to lead our round and put a price on that and led the negotiations with Telefonica. And those were tough negotiations at a really difficult time and during the pandemic. So all Zoom calls, no FaceTime, which makes it a lot harder when you're doing business like that. Through Ancora, we were introduced to Wellington Partners, to MTIP, to Asabys, to Akilia, to Mundi Ventures, to Creas, and one or two high net worth individuals. And together, we managed to raise an oversubscribed 30 million euro Series A capital raise. And lo and behold, we were an independent company.
So then tell us about scaling as well, because I mean, you guys now have about 67 employees or so. You have about 500 clients plus. So how has it been to the process of you achieve product market fit? You've been able to validate. Now it's time to think about scaling.
Yeah, so not without its challenges. As I mentioned, but just to make it explicit, with the Telefonica support, we were in stealth mode. So we had no product in the market apart from tests and prototypes. We had no salespeople at all, no marketing materials, no website, no public presence. So starting from day one, we had to learn all of that stuff in a hurry. And we were launching into the world in the pandemic, which is challenging and difficult to cut through. Plus, the product that we started with, because it was the easiest from a regulation perspective, was a prevention product. So think about it as a bit similar to Calm and Headspace. And these were two brands which were already very well established in the direct-to-consumer market, but also had begun to sell into businesses. And we decided early we wanted to sell into businesses. And frankly, we found it a much more crowded marketplace than we expected. And we found it harder to cut through and get our messaging across during the pandemic. So that led to a few years really where we were generating a little bit of revenue from Koa foundations, but also through consultancy relationships with a couple of medical device and pharmaceutical companies, and really trying to manage the size of the team whilst we were working on our clinical products, both in the prediction AI and also the therapeutics, in order then to be able to build a clinical solution, which is very different to just Calm or Headspace.
Now, in your guys' case too, I mean, one thing that is really interesting is that you've been involved with AI for a while. So how does it look like now? You know, everyone is talking about AI. You know, it's like this perfect wave happening, and this is something that you actually started to look into about 10 years ago. So how do you see things, you know, happening? How do you see Koa benefiting too from being able to ride that wave?
Yeah, wow. So I think there are two things going on here. One is the hype curve that we've all seen before with previous technologies. And I think some of the more outlandish expectations of AI are maybe beyond what we're going to see, certainly over the course of the next few years. That said, the combination of ever more powerful and ubiquitous computing, not least the cloud transformation, which means that through the web, we can get access to very, very powerful computing with advances in mathematics, with a combination of imagination and creativity, really has created transformative technology. People don't really talk very much anymore about the Turing test, where you interact with a computer and you can detect if it's human or computer based on its responses, because actually a readily available ChatGPT can pass the Turing test, right, for most people most of the time. We've also seen enormous advances in the practical application of AI. So, for example, protein folding and the fact that we now can design drugs specifically to interact with a particular protein by looking at how that particular sequence of DNA will lead to a sequence of amino acids, will lead to a certain structure of protein. That's a massive transformation. I remember when I was at Cambridge in the 90s, the drug discovery process started with having 1 million drug candidates and trying all of them in the lab, one after the other, and seeing which one binds with the receptor. We can now do all of that stuff with a fraction of the cost and the effort. So I think all to say, the era of AI is here. We've reached a level of computing power and a mathematical toolkit which has a lot of potential. And at the same time, of course, society is digitized. So we have available to the AI a lot of data around us as citizens, around healthcare, around travel, around banking and finance. And that combination really is leading to this revolution. And then you add the funding that's going into AI companies and research around the world. And we really do stand on the edge of a revolution. It'll be fascinating to see how it plays out.
So, talking about how it plays out, let's say you go to sleep tonight and you wake up in a world, Oliver, where the vision of Koa Health is fully realized. What does that world like? What does that world actually look like?
Yeah, so our vision at Koa is mental health for everyone. And we mean everyone, poor, wealthy, younger, older, people living in countries around the world. And I'm really fascinated by two aspects of that. The first is the sheer potential to unlock human ambition and human potential. Um, if we think about people who are experiencing mental disorders, people with risk factors for mental disorders, people who feel shame and stigma, imagine all of that falling away. And what we could all achieve as families, as communities, as nations, and as a global society. Um, the second is also the social impact. If you can get access to mental health treatment just like that, there's no cost barrier, there's no waiting time. Why stigma? Why is this something to be ashamed of? And the social impact of taking the fear out of mental health and turning this into something which is ubiquitous, I think has the potential, let's say, to transform society's view of mental health from something to be feared to something to be embraced.
Now, as they say, entrepreneurship involves depression, unfortunately. And there's probably a lot of people that are listening to us that are, dealing with it. What message do you have for them?
Well, sometimes entrepreneurship feels like bipolar disorder with radical highs and radical lows. I think you do need to be somewhat obsessive in terms of how you think and compulsive in terms of how you act. And look, in all seriousness, there is a higher rate of mental disorders amongst entrepreneurs and their families than there is in the general population. Um, so I would say, blessed are are the cracked, for they let in the light. Right. So people who have a slightly unusual take on life maybe bring a transformative level of innovation to seemingly intractable problems. So maybe it's a little bit to do with how atypical I am, that I didn't just settle for sitting in a clinic writing prescriptions for antidepressants and antipsychotics in my career, but really embarked on a different journey, which has brought me to a different place. So I would say, look after yourself, celebrate your individuality, find peers and mentors who can provide support along the journey, and make sure you keep the cup topped up. You can't pour from an empty cup.
I love it. Now, imagine I was to put you into a time machine, Oliver, and I bring you back to that moment that maybe you were in Abu Dhabi and you were thinking about packing up the bags and entering the venture world. And you had the opportunity of having a chat with your younger self. Let's say, that younger self that is getting on a plane, en route to Europe. And you're able to sit down next to that younger Oliver and give that younger Oliver one piece of advice before launching a business. What would that be and why, given what you know now?
Well, I would say at the time of spin out from Telefonica, the thing to do with 30 million euros in the bank is to significantly reduce the cash burn and make that 30 million last for as long as possible. Time flies very quickly, and achieving product market fit in the best of times is a challenge. And it's really important to control your burn rate. So I think in the transition between Telefonica and being a VC-backed startup, we missed the opportunity, let's say, to be more radical in restructuring the team and restructuring the cost base in order to give ourselves as much time as possible.
I love it. Oliver, for the people that are listening, that would love to reach out and say hi, what is the best way for them to do so?
drop me an email, oliver.harrison@Koa Health, or one word, KOA Health.com.
Easy enough. Well, Oliver, thank you so much for being on the Dealmaker Show today. It has been an absolute honor to have you with us.
Thanks, Alejandro. It's been fun.